Hey everyone, in today's video I'm going to talk about 3 things I hate about nursing. Before I begin, please consider subscribing down below. I'll be uploading a new video every single week. Alright, so what do I hate about nursing? The first thing I hate about nursing is being short-staffed. I mean, it happens so many times on my shift where we're short-staffed, and I actually have a pretty crazy story that I'm gonna upload and share with you guys about a time where I had 7 patients. That's absolutely ridiculous. That's double the workload that one nurse should have. But because we were so short-staffed, I had 7 patients, and it happens way too often, and it really causes, of course, you feel really stressed out, but it also causes you a lot of anxiety, and it's very dangerous. I mean, it's very dangerous because firstly, it is very bad for the safety of the patient, but it also is really bad for your license because, you know, if you're having 7 patients, you're trying to do things so fast, and as a result, you're more likely to make a lot more mistakes. So the second thing I hate about nursing is the fact that generally providers are not very nice. I don't know why that's the case. Doctors, nurse practitioners, as far as I'm concerned, majority of them actually are not very nice people. Like when you call them, they're kind of really short with you, and of course they're very busy, and they have a lot on their plate. But at the same time, so do we as nurses, and I don't think I've seen many nurses be rude to other disciplines like doctors or providers have been to nurses. So it's definitely a weird culture that I guess we as nurses have become accustomed to, but I think in the future I would like to see more nurses stand up to providers and not accept so much of their hatred and kind of their poor attitude in the workplace. All right, so the last thing I hate about nursing is the fact that nurses are generally pretty mean to nursing students. Now, there's 2 types of nursing students that I'm talking about. The first is a registered nurse who is gaining further education onto a certain ward or unit, say for example the ER or labor and delivery or ICU, for instance, or whether it's a nursing student learning to become a registered nurse. And this culture is definitely shifting. I know it's been a lot worse in the past, but you definitely see it a lot, and I really hate that. I think, you know, we were all students at one point, and I've noticed on my unit and other units, some of the nurses are quite mean and demeaning to the nursing students, and I don't think that's right. A nursing student is definitely just learning, and they're new to many different aspects of the field, and I think it's absolutely unacceptable. And it's hard because a nurse has the power in that relationship. When you're shadowing or following a nurse, that nursing student is really oppressed, and they don't have much say, and they try so hard to make sure that they impress that nurse that they're following. And unfortunately, many times the registered nurse that has that student is quite mean to the nursing student, and I definitely don't like that. And every time I see that happening, I definitely talk to the nursing student, and I just tell them, you know what, don't listen to that person's being really mean and disrespectful. All right, so those are 3 things that I really don't like about the nursing field. I hope that you enjoyed this video. Please give it a thumbs up if you thought it was interesting. Leave me a comment below. What are some things you hate about nursing that you'd like to share with me?